AAAM AIS CAISS Head Exam latest actual exam and practice exam with complete questions and correct detailed answers. Question 1. AAAM AIS CAISS Head Exam latest actual exam and practice exam 2026 to 2027 with complete questions and correct detailed answers brand new version. How do you code a through and through GSW to skull? 116,004.5 greater than 2 cm penetration. However, if you know more details to specific organ damage, this cannot be used. 116,004.5 greater than 2 cm penetration. However, if you know more details to specific organ damage, this cannot be used. Question 2. In a penetrating injury to the head, if the skull is not penetrated, how do you code the entry? Coded as a scalp laceration. Coded as a scalp laceration. Question 3. True or false, cranial nerve injuries may be described only by the type of dysfunction that exists in the normal nerve activity. True. False. True. Question 4. For cranial nerves, how do you code total loss of nerve function? Paralysis. And how do you code partial loss of function, aka paresis? Code total loss as a laceration and partial loss as a contusion. Code total loss as a laceration and partial loss as a contusion. Question 5. Name the first 6 cranial nerves. I. Olfactory. 2. Optic. I. Olfactory. 2. Optic. Question 6. 3. Oculomotor. 4. Trochlear. V. Trigeminal. 6. Abducens. Name cranial nerves 7 to 12. 7. Facial. 8. Auditory, aka vestibulocochlear. 9. Glossopharyngeal nerve. X. Vagus excludes injury in neck, thorax, or abdomen. 11. Spinal accessory. 12. Hypoglossal. 7. Facial. 8. Auditory, aka vestibulocochlear. 9. Glossopharyngeal nerve. X. Vagus excludes injury in neck, thorax, or abdomen. 11. Spinal accessory. 12. Hypoglossal. Question 7. On old Olympics towering tops, a Finn and German viewed some hops. Mnemonic to remember the cranial nerves. Mnemonic to remember the cranial nerves. Question 8. True or false, injuries to internal organs such as the brainstem, cerebellum or cerebrum must be verified by CT, MRI, surgery, X-ray, and angiography or autopsy. True. False. True. Question 9. Name parts of the brainstem. Hypothalamus, medulla. Midbrain, pons. Hypothalamus, medulla. Midbrain, pons.